Long-acting antiretrovirals, and here focusing on cabotegravir and rilpivirine, have been studied in hundreds of people. However, there are some key populations who are under or unstudied. Let's start with pregnant and breastfeeding women, so often excluded from trials. Thankfully, we are moving more towards studying pregnant women or keeping them in studies if they become pregnant. But really, if we were studying pregnant women from the start in parallel, we'd have the answers to some important clinical questions sooner. Now, rilpivirine, we do have experience with the oral version of that drug. More than 700 live births on the antiretroviral pregnancy registry with no concerns. For cabotegravir, as of January 24, just 20 first trimester exposure live births on cabotegravir. So we really need to get more data. What data we have seen is relatively reassuring, although case report, it's N=1, does suggest some concern about rilpivirine concentrations in the third trimester, something that's in common with oral rilpivirine, where more frequent viral load monitoring is recommended. Now, these drugs aren't recommended in the license or in guidelines, but so far there have been no safety or efficacy concerns. Another really important population is younger people. Now, we have no data for paediatric populations. The MOCA study is looking at 12 to 17-year-olds. We've seen some promising preference and tolerability and PK data from MOCA so far. We'll be seeing some more data this year, so that's certainly a study to watch, but again, arguably a population that should be studied sooner. And finally, some of the specific challenges for trans populations. At least now we are counting the number and proportion of trans people in clinical trials, but we need to be doing better so we can answer these important questions sooner.